They are supporting the body's own process of repair at a cellular level. And it's really very important to understand. Uh, if a patient has chronic kidney disease or has diabetes or has lupus or multiple sclerosis, there might be this notion that, quote, stem cells can cure those diseases. I would encourage everyone to take a full step back and please tell me first how many patients on insulin have been cured of diabetes? How many
I
patients
like
on
to think of it,
steroids
if
have
I
been
might
cured?
interject. Yeah, I
Yeah,
just want to interject. I kind of tell patients this presentation, think of it as that the growth factors are those upregulating things that are in the slurry of umbilical cord tissue or amnion tissue or Wharton's jelly, all those PDGF1, PDGF2, all those different things that are cytokines, which are anti-inflammatory, are kind of like fertilizer for grass, rather than thinking of them as live cells that are incorporating somehow.
I like that. I don't use fertilizer. I usually compare it to osteoporosis. Almost everyone understands that if you have thin bones, as you age, you need calcium, magnesium, and vitamin D. And no one would call those a stem cell, right? They're supplements. But sure enough, if we don't have them, our bones will break. Well, you need calcium, magnesium, and vitamin D, and without those, your bones get soft. In kind of like your fertilizer model, there are growth factors, specifically collagen-based growth factors, in these birth tissues. Those collagen-based growth factors are no different than calcium, magnesium, and vitamin D, because as our joints start to age, we don't make and we can't consume enough collagen, especially the unique subtypes of collagen that are in our joints to be able to keep our joints healthy. Can you use the growth factor complexes that are in these birth tissues to supplement, like your fertilizer model, cartilage-based defects? You can. Will those growth factors and their influence on the body's own cytokines, the body's own interleukins, down regulate inflammation so that the body can actually go through the cellular process of healing? They in fact can.